I think even though we have these new drugs and new agents, what I wanted to do is emphasize the fact that we still have to recognize that there's no treatment that is without side effects. And what we have with chronic lymphocytic leukemia is a disease that's very heterogeneous. And in other words, some patients may get diagnosed and have a very indolent clinical course free of any symptoms for many years, and then other patients may actually progress rather rapidly and have disease-related complications. And it's not always apparent at diagnosis what patients are going to go on and progress and which ones may have a very indolent clinical course. And I think it's important that we don't jump the gun and treat patients prematurely, because a patient who doesn't have any symptoms, who has no disease progression, and has a good quality of life that's not affected by the disease, is it really makes sense to give the patient a therapy that might have some side effects? So I think that even with the advent of these newer treatments, we still have to be using common sense approaches and treat patients who need therapy, namely patients who are demonstrating clear signs of disease progression within a relatively short time, within a year, or have disease-related complications. And they're primarily involving the complications of the marrow involvement, where they may have limited marrow function with anemia, thrombocytopenia, or neutropenia. And our patients can also develop immune-related dysfunctions.